Do you know how to help somebody who's maybe drank a little bit too much and you're worried about their airway? Do you know what to do? I'll watch this video all the way through to the end, because we're going to be talking about the recovery position. And we're also going to talk about what to do if you find somebody maybe that hasn't collapsed on their back or laying on the back. Maybe they've actually collapsed face down, or maybe they're slumped over a chair. Do you know how to help them? Do you know how to protect their airway? So don't forget to watch this video all the way through to the end, because you never know when you might need these skills to help save somebody else's life or to protect their life. And also, please hit the subscribe button so you don't miss out on any important information. Okay, so the very first thing we're going to do then is there's a casualty on the floor. We've walked into the room. We're checking the air for danger. We're looking, we're listening, we're smelling for things that are dangerous, such as fire, other people being there, things that have fallen down, things that are touching them. We make it safe if needed. We talk to the casualty to see if they're awake. If they don't respond to my voice, I'm going to push on their shoulders gently to see if I can get a response, or maybe make a loud noise. They're not responding to me. Now I'm going to shout for a helper, because I want a helper to get me a first aid kit, especially if I'm in a workplace. Now, if I was in a workplace, this is when I would put my gloves and PPE on. In this example I'm showing you, I'm in a home situation, but in a workplace, please put your appropriate PPE on. And then going to open the airway by doing a chin lift and a head tilt. So one hand on the forehead, two fingers on the chin, and pushing the forehead back and lifting the chin up. I'm getting nice and low to this casualty. And I'm looking and I'm listening and I'm feeling for normal breathing. So I'm feeling with my cheek, I'm listening with my ear, and I'm looking at their belly or their torso rising and falling. And I'm checking for 10 seconds. Now, if someone was breathing normally, an adult would breathe between 2 and 4 times if they were breathing normally in 10 seconds. If you're doing this on a baby would be breathing 10 times in 10 seconds. Now, it's really important to check for normal breathing, because if someone has something called agonal gasps, which someone goes, this can be the last breath that someone breathes. And actually, they might need CPR performed to them. So please check for normal breathing for 10 seconds. Great news, the person is breathing normally. So then what we're going to do is do our secondary survey. We go from the head all the way down to the toes, and we're looking for anything such as bleeding or broken bones, or anything that can explain why this person is injured. So we're checking the head for any lumps and bumps, looking for fluid coming out of their ears. If they've got fluid coming out of their ears, it could indicate spinal issues. Looking to see if they've got those medical ID necklaces on. We then look down one arm at a time. I'd roll up the sleeves, have a look for lacerations and also bracelets. I'll do the same on the other arm. I will then check the torso to make sure the sternum's okay, make sure that the belly, there's no hard bits on the belly. If there was, it could indicate internal bleeding. I gently push on the pelvis to make sure it's still intact. Then I use my back of my hands to see if there's anything in the pockets. The reason I use the back of my hands is because if they did have something sharp in the pocket, I'm more likely to grab it if I went palm down, and therefore I might hurt myself. And then I check one leg out at a time. So that's the primary survey, then the secondary survey. Then, now I've found no injuries with this casualty, I'm going to place them into the recovery position. Now I do this by putting both my arms on the other side of the patient, so I lean over. The hand closest to the casualty's head, I'm going to link fingers with them, and I'm going to gently bring it across their body and slap their cheek closest to me. But I'm still holding my hand in place. I won't let go, because if I did let go, the hand will just flop back down again. So I hold it in place. With my other arm, I lift the outside of their leg, lift the knee up, and push their shin and their foot towards their bottom. And then all I simply need to do is use one finger or very gently push their knee towards me, and they will roll over on their side. I need to make sure the knee is at 90 degrees in order to make sure they stay on their side, and then I open their airway. And the reason they're on their side is because it's allowing the airway to remain clear, If they're sick or they've got any vomit or blood in their mouth, it's just going to drain away. I'm going to keep checking and monitoring their breathing while they're in this position. And if it hasn't been called already, I would now call the ambulance. Now, we put them in the recovery position because it allows them to maintain an open airway. And that's really important, to have an open airway. However, if we find they've got a broken leg or a broken arm, or we forget how to do the recovery position, then what are we going to do? Well, we kind of do the same thing. We maintain an open airway. So that means they stay on their back and we just keep their airway open. The downside of this, however, is that my hands are now attached to that casualty. So ideally I need them in the recovery position, because if I let go of the casualty's airway, it will close again. And that's when the airway could be blocked and they might stop breathing. So if you can't move them because A, you've forgotten how to do it, or they've got an injury, then all you need to do is maintain an airway. So hold the airway open, because that is the recovery position. And if they start to be sick, well, you know, all you need to do is tip them on their side to keep their airway protected. Okay, let's make it harder again. What happens then if you find them face down the bottom of the stairs? We do exactly the same, don't we? We still do our primary survey, our DRAB. We check the air for danger. We check for response by talking to them. We give them a bit of pressure on their shoulders to see if they wake up. Now in this case, if they're at the bottom of some stairs, you don't particularly want to move them in case they've got a spinal injury. So we can't open the airway in the position they're in, but we can still check their breathing by looking at their back rising and falling, by maybe putting our hand underneath their mouth and nose, see if we can feel them breathing, getting close to them so we can see if they're breathing. If they are breathing, we don't need to move them. They can just stay there and we can make a phone call to the emergency services. Okay, let's do harder again. What happens then if they're face down and they're not breathing? What are we going to do then? Well, quite simply, you still do your danger response airway breathing. This time we found out they are not breathing. Well, we're going to have to turn them over, aren't we? Because if they're not breathing, then we might need to do CPR. So in order to turn them over, we kind of make them into Superman, because it's quite hard to turn somebody over that's got their arms down by the side. It's a bit like pulling somebody over a speed hump. So what we need to do is put the arm up above in the air, like they're flying through the sky like Superman. Being careful though that the arm goes around and doesn't go up and over and we dislocate the shoulder. When the arm is above, then we just lean over and grab a shoulder and hip, pull the solid bits of the body, pull them towards you, just catch your head so it doesn't bang on the floor. And then when they're on the back, that's when we can open their airway, and that's when we can look, listen and feel for breathing. And if they are breathing, then you can just maintain an open airway. Now I say you can just maintain an open airway. That's great if you can stay with that casualty. But if you do have to leave that casualty, let's say to go and open the door for the emergency medical services, then you're going to have to remember the recovery position. So you need to remember how to get them in that recovery position. Okay, so now we've done face down, suspected spinal, but they are breathing, so we'll leave them. We've done face down, we don't think they're breathing, we can't see them breathing, so we're going to have to turn them over to check they're breathing properly. What about then, sitting on a sofa or on a toilet? What are we going to do then? Guess what? Exactly the same thing. We come in, we check the air for danger. We check for response by talking to them, give them a bit of pressure on the shoulders. We open the airway in the position they're sitting in. We don't need to get them to the floor yet. And then we look, listen and feel for normal breathing. If they are breathing, well, we can just keep the head back and maintain that open airway. If they're not breathing, well, we need to be shouting for help quickly, because now we need someone to help us get them to the floor. And trust me, it's not easy getting someone unconscious to the floor by yourself safely. So that's what we do if we find somebody in a position that maybe is not taught on a first aid course. We'll not all have the luxury of having loads of space around a casualty. They might be on the toilet, they might be on the bed, they might be on the sofa. You need to adapt the skills you've learnt now or on a first aid course, and would always encourage you to do a first aid course, and to adapt these skills to the environment that you have. Just always remember, breathing comes first. You need to assess the person's breathing. If they are breathing, maintain an airway. If they're not breathing, you need to do CPR. And I'll leave links to videos down in the description below of how to do CPR, especially with COVID around as well at the moment, in the links below, as well as some e-learning courses. And there's some free learning courses that you can sign up for, which will get you a certificate at the end as well.